So the next speaker is Kinson, speaking on the web-based image access. So Kinson, take it away. Thanks.
Thank you. So I'm going to talk about web-based image access, and some of you may have heard formerly it is known as MHD-I, or Mobile Access to Health Document for Imaging. My name is Kinson Ho. I'm with Change Healthcare. I'm also currently the Radiology Technical Committee co-chair. So this is a preview of what is coming up. We're still working on an updated version that is ready for public comment. So it is a sneak peek. So it is a short one. And later, when it's finalized, a more detailed presentation will be presented in next year webinar. So the problem trying to solve by this profile is we're trying to modernize some of the access to imaging studies so that, like Kevin mentioned earlier in the first presentation, people familiar with the web technologies, they can easily access to imaging studies. And also another important problem we're trying to solve is both image sharing and interactive viewing. We have already quite a number of image sharing profiles or technologies. They're good, so we're enhancing that to allow some web-based protocol access. So that's an improvement. But also, quite sometimes, many of the existing image sharing protocols, they may be not as efficient for interactive viewing purpose. So we explicitly trying to improve that support by introducing some mechanism to support that. And because it's using the web access using a RESTful API, that side benefit of that is also it allows much easier for integration purpose with many different applications or EMR, different system. That is a growing trend of many of the application development is integration is a part of the core development. So for this profile, the value proposition is that it defines methods for image sharing and interactive viewing of imaging studies using RESTful services. And the key one that we're using here is the WATO-RS and Keto-RS. Those are the new services that are provided by the DICOMweb. And the key thing here is, as I mentioned earlier, is support image sharing, interactive viewing using RESTful services. So some of the key use case, those are the two. Image sharing, it uses Keto-RS to first allows you to discover studies, for example, and then you can use WATO-RS to retrieve the studies. There's a very standard basic use case that allows you to do basic query retrieve for image sharing. When you go to interactive viewing, the same RESTful API, it already gives you additional capabilities. For example, with Keto-RS, you can interactively get more study or series metadata at the series and instance level that allows your viewer to have a better determination of which images to retrieve, the order, the priorities of the images to retrieve. That helps viewer implementation significantly. And then with WATO-RS retrieved, you can retrieve at the study level, you can retrieve at the instance level, also you can retrieve metadata and bulk data. It gives you more fine-grained control of what to retrieve. And the combination of those, because of the technologies provided, it allows you to have a better implementation for interactive viewer. And so here is some technical highlights, what this profile is going to bring you. I'm not going to give you provide too much details at this point because we're still working on finalizing some of the details before public comment. So here are some highlights. The profile, the mechanisms defined is neutral about different backend image sharing infrastructure. So for example, we can work with XDS, XDS-I, or more traditional DICOM, or the new one with the DICOMweb. And those backend support is kind of hidden behind the imaging document responder. So when it receives a query from the consumer, the responder is then responsible to find the right information by integrating with different backends and provide the result in the proper Keto RS response. And once the response comes back, including the retrieve location information, the consumer can now use a water retrieve to retrieve the objects according to his need. This profile also will have the ability to integrate with the ITI MHD or mobile access to health document profile. And in particular, when the MHD document consumer identifies a manifest or imaging study, it can then use this profile to locate and interact with the imaging study more efficiently using some of the metadata provided by the document consumer in MHD. So instead of have to fetch the manifest and parse the DICOM key objects, for example, using this profile, it gives you a more efficient way to interact with the imaging study. Especially, for example, you can do a query to find additional study metadata. So, as I said, it's a very quick, high-level overview. It is a major update to MHD-I, which was published a few years ago, but it has gone through significant update based on the content, the high-level content that I provided earlier. So it is currently still in a work in progress. So we'll hopefully that maybe in a month or something that we can publish public comment. So make sure you watch out for the announcement when the profile is ready for public comment, and I'm looking forward to all your comments on this profile. And if you have any questions, you can contact me. But make sure you watch out for the public comment announcement.